As OBGYNs, we are expertly trained to provide care to women during all points of life and understand the challenges that women can face during perimenopause and menopause. Perimenopause is defined as the transitional period leading up to menopause, often characterized by irregular menstrual cycles and varying levels of reproductive hormones. Symptoms can often include hot flashes, night sweats, mood swings, sleep disturbances, and vaginal dryness. We will often use hormone replacement therapy, or HRT, or birth control pills during perimenopause to help stabilize hormone levels, alleviate symptoms, and improve quality of life. Menopause is defined in the stage in a woman's life where menstrual periods permanently cease, typically diagnosed after 12 consecutive months without a period. Symptoms are often similar to perimenopause, but can also include joint pain, decreased libido, and long-term risks such as osteoporosis. Hormone replacement therapy can be used during menopause to continue to relieve symptoms and reduce the risk of osteoporosis and fractures. Hormone replacement therapy is treatment used to alleviate symptoms associated with perimenopause and menopause by replenishing the hormones that the body no longer produces in sufficient amounts. The primary hormones involved are estrogen and progesterone, although sometimes testosterone replacement is used. There are different types of hormone replacement therapy. Estrogen-only hormone replacement therapy is typically prescribed for women who have had a hysterectomy. Combined hormone replacement therapy, or estrogen and progesterone, is used for women who still have their uterus, as progesterone helps protect the lining of the uterus from the risk of cancer caused by unopposed estrogen. Progesterone is often prescribed as a pill or a Mirena IUD. Bioidentical hormone replacement therapy uses hormones that are chemically identical to those produced by the human body. This can be prescribed as an FDA-approved prescription. Despite misinformation that this is only available as a pellet or compounded option, we typically don't recommend pellet therapy due to the lack of regulation for the purity and potency. For some women, we might recommend compounded hormones depending on specific circumstances. The benefits of hormone replacement therapy with estrogen and progesterone can be relief from menopausal symptoms such as hot flashes, night sweats, and vaginal dryness, also improved mood and sleep patterns, prevention of bone loss and reduction in the risk of osteoporosis-related fractures, possible reduction in the risk of colon cancer and heart disease when started near the onset of menopause. Regarding hormone replacement therapy, there are risks and considerations. We feel strongly that the best course of action for you is an evidence-based medical approach, modified as needed to your individual circumstance. Some studies have shown an increased risk of breast cancer with long-term use of combined hormone replacement therapy. We will discuss that with you and tailor the hormones to your specific needs. Similarly, there may be an increased risk of heart disease, stroke, or blood clots, particularly in older women or those starting hormone replacement therapy more than 10 years after menopause. There is an increased risk in endometrial cancer if estrogen is taken without progesterone in women with an intact uterus. With testosterone in particular, there can be side effects of acne, unwanted hair growth or loss, enlargement of the clitoris, voice changes, potential increased risk for heart disease, and mood changes. Testosterone, although primarily known as a male hormone, is also produced in smaller amounts in women and plays a crucial role in female health. Testosterone treatment for women is sometimes considered for conditions such as decreased sex drive, also known as hypoactive sexual desire disorder, or other issues related to low testosterone levels. Indications for testosterone therapy in women include lack of sexual desire or hypoactive sexual desire disorder that is distressing to the individual. Regarding menopausal symptoms, some women experience persistent symptoms such as fatigue, mood changes, and decreased libido despite estrogen therapy. Those are women that we might consider testosterone therapy. Testosterone therapy is sometimes used for women who have undergone an oophorectomy, which was removal of the ovaries, and we think may benefit from testosterone therapy. With all hormone replacement therapy, we encourage an individualized approach. That requires an assessment and thoroughly evaluating your personal and family medical history, risk factors, and symptom severity. We tailor dosage and duration for the lowest effective dose for the shortest possible duration to manage your symptoms. And then we encourage regular follow-up with monitoring and reevaluation of the treatment plan, sometimes with lab monitoring for women who are being treated with testosterone. Hormone replacement therapy can be an effective treatment for managing symptoms of perimenopause and menopause, but it must be tailored to each patient's needs and health profile. We understand that perimenopause and menopause are hot topics on social media and that it can be challenging to navigate through the misinformation. This area of healthcare has seen an influx in many non-GYN providers offering to test hormones with large expensive hormone blood tests that often aren't necessary. Regular follow-up and open communication with your OBGYN are essential to ensure the benefits of hormone replacement therapy outweigh any risks.